So what is the starting time for preparation and what is the ideal thing? You will not be able to solve it. Then you will think that is the source what I am reading is right or wrong? Should I go for another source? That's where the confusion starts. Learn, make mistakes, make sure read the explanation, apply that in the next question which comes, right? 6th question is for your comfort level. 2 questions little bit outside the comfort level. The last 2 questions is to push it down. Every single thing will look amazing for you. That's the right time to put your foot down and say, let me solve it. Let me do PYTs. Let me take the hit. It's going to be wrong maximum, that's all right. This is the most common query from most of the students who are in the first year or second year of MBBS, asking when do I start preparing for NEET or next exam, which you're going to write like 3-4 years down the road. Is it ideal to start preparing now? Some of my seniors say that start preparing very early. Some of them say that start a little bit later. Some of them say do it after internship. Now focus on the standard books. So what is the ideal time to start preparing for a NEET or an INICT to be in the top, maybe in the 99th or 100th percentile, whichever every MBBS aspirant aims to? That's what I'm going to discuss in this video. I'm Dr. Ranjith. If you're first time here to the PW Med YouTube channel, let's learn more about pathology medicine exam prep as a whole. Now let's come back to the primary problem. So what is the starting time for preparation and what is the ideal thing, right? See, obviously, if you ask me, there's nothing called as ideal. It obviously varies a lot. But I'll definitely be able to give you a template on which is right, which is the right way to do, and listen till the end. And if you have any comments, put in the comment box. So first thing, should I start preparing MCQs from the first year? The answer here is straightforward. The answer is yes, because your university exam also has 20% of MCQs. I'm not saying that you have to start preparing for a NEET PG or a next exam or a INICT from first year, right? So MCQ solving is nothing but a way to test your knowledge, a way to understand the concepts. Have you gotten the grasp of the concept? There's nothing wrong in doing MCQ from first year. Like I said, this MCQ will definitely help you to solve the university exam. University exam has good number of MCQs for you, right? So 20 marks in a single paper is not less, right? If you collate 3 years of 3 papers in first year and second year, it comes to significant amount. So yes, that's a mandatory thing you have to do as a part of the curriculum to clear the university exam, right? But the question is, some of the MCQs, if you solve, let's say you solve a PYQ, you will not be able to solve it. Then you will think that is the source what I'm reading is right or wrong? Should I go for another source? That's where the confusion starts. PYQs of a NEET PG next exam or an INICT exam is designed for a post MBBS student. In a first year or in the early half of second year, you cannot solve it. So don't get demotivated. That's how it will be. Because meant for a person who has completed 4 years of MBBS and also practice in the internship and then to solve it, right? So don't do this mistake. Past year university papers, yes, do it. But should I stop myself? Should I restrain myself? The answer is absolutely no, right? So what's the ideal time to go to the PYQs to go and try test the waters for the NEET PG or next or INICT preparation, right? I'll just give you a simple thing, right? So in first year, I want you to go with the hardcore concepts, whatever is there in your. I'm sure that Pawar sir, Jambulkar sir and Vivek sir must have made your concepts amazingly strong, right? And definitely do the university questions, okay? So should I restrain from PYQs of NEET PG or next or INICT? Do them, but please do them with a notion of learning, with a motive of learning and not to solve, right? So this PYQ here is for learning and not for testing, right? It's purely for learning because you're very, very early in the career. You will become amazing. Believe me, 100% you'll become amazing. You're very early. Learn, make mistakes, make sure read the explanation, apply that in the next question which comes, right? Again, not much of emphasis on an NEET PG or an INICT MCQ in your first year, right? Second year. So in second year, I want you to divide second year into 2 different halves. The first half of second year or the first 2 sems or the second half of second year, which is after 6 months. In the first half of second year, you will not be very confident in solving scenario-based questions because multiple things keep going. Because what you read is general pathology, not much of cases, general pharmacology, general microbiology, immunology and focus goes there, right? Not much of cases there. But in the second half of second year, that's where I want you to really test the waters of NEET PG, INICT or FMG if you want to be in the top percentile. The reason is, there are multifold reasons here. In the first half, again, go with the concepts. If you're a Nishchay batch student, I'm sure that you must be enjoying the classes. If you have any doubts, please connect with any one of us. And make sure you attend the live classes, ask your doubts, do the DPPs, daily practice questions. Slowly we'll infuse the idea of solving an MCQ. The DPPs are designed in a very scientific methodology that I'm going to teach a topic. I'll push a limit. There are like 10 questions. 6 questions is for your comfort level. 2 questions little bit outside the comfort level. The last 2 questions is to push it down, to make you make a mistake. That's how the DPPs are designed, right? So this is just to make sure you are ready for the real life preparation, fine? Now the second half is where I want you to take the preparation for NEET or next INICT bit more seriously. I'm not saying that go back and go and revise everything, go do the PYTs, not that. When I say a little bit serious, why I'll tell exactly. Because this is the time you must have had the exposure to clinical postings as well. Yes, your history taking must have been there. So this is the time you'll be very eager to learn. It'll be fascinating to see an anemia, to see a pallor in the lower palpebral conjunctiva. It'll be fascinating. To see the clubbing, it'll be fascinating. That's when you have the maximum interest. Believe me, it will slowly decline over the period of time. And more exam comes, you'll be more exam oriented, right? This is where the eagerness is very high. So during this time, when you start solving scenario based question, and the most important thing is, in the same time, right? In the same time, you'll go to hematology, systemic pathology, you'll go to systemic pharmacologies, you'll go to system-wise learning of microbiology. So actually it's a perfect time. Second half of second year, I want you to take any standard books, be a Robbins review book or a Tripathi or a Katz's review book, any review books. Try to solve them slowly and steadily. Again, you will make mistakes here 100%. If you don't make mistakes, you are a flaw. You will make mistakes, learn from the mistakes and apply them. Because like I said, the interest and eagerness and the right time is this. So once you miss this boat, later on it will be a bit difficult. I'm not saying you will not do it. You will 100% do it. But what happens is, when you come to third year, you'll become lethargic. Only forensic and PSM, right? Let's relax. Let's call it a honeymoon period. You'll be very relaxed. And then when you come to final year, huge number of books, huge number of things to read. That time you won't have that interest. You will solve, but you won't have the curiosity. The childlike curiosity will be lacking when you go to a little bit later in your career, right? So that childlike curiosity will be here. Every single thing will look amazing for you. That's the right time to put your foot down and say, let me solve it. Let me do PYTs. Let me take the hit. It's going to be wrong maximum. That's all right. It's fine. Let's do it. So that's the exact time where I want you to go and start preparing for your NEET PG, INSG or FMG, whichever exam you're targeting, right? So please do remember, second half of second year, what to do. So obviously the biggest concern is source, right? So can I do any source? See, if you're a med student, you will have DPPs. Over the period of time, the DPP slowly will be increased a bit notch higher. It will be a bit difficult for you, not in a motion to demotivate you, just in a motion to make you learn a little bit more, right? That's one. You have Q banks in your MedApp that also will give you a good amount of resources for you to solve. In every Q bank, MedApp is designed such that the PYQs will be aligned with the topic. Let's say you read about RBC disorders. The PYQs of RBC disorders of NEET, INICT and FMG will be there right below it. We have not kept it separately. Separately also is there. It's there right below it. So it's easy for you. Okay, I've done RBC disorders. Let me see. Let me test the waters of how INICT questions are. Let me try it, right? That's how you have to be done, right? And obviously you have many tests here. You can use this source for sure. If you want an extra source, I would say go with every standard review books. Robbins has a review book, Harrison has a review book, every standard author. Gray's Anatomy has a review book. They have superb, very difficult scenario-based question. Try to solve them, right? So that's about this video, just on how to start and when to start your preparation. Like I said in the start, if you have any more queries, put down in the comment section. Let's see, let's discuss, let's have an open conversation, open debate, and let's make ourselves better. See you soon. Till then, bye-bye from Dr. Ranjith. Bye-bye.